millions of people across the globe rely on ibuprofen, a nonsteroidal anti-inflammatory drug, or NSAID, for treating different types of pains ranging from headaches to arthritis. It is one of the most popular over-the-counter, or OTC, pain relievers for all ages. However, the usage of ibuprofen among older adults over the age of 50 is more common than in any other age group. While ibuprofen may provide relief from pain and inflammation, it is essential to understand its potential dangers, particularly in older adults. According to recent statistics, 30% of adults over the age of 50 in the United States use OTC pain relievers like ibuprofen to manage chronic pain. However, many older adults are unaware of the side effects and risks associated with prolonged usage of ibuprofen. Due to this, it is important for individuals over 50 to be informed about the potential dangers. So, if you or someone you know is over 50 and uses ibuprofen regularly, continue watching the video to learn more about ibuprofen's hidden dangers and, most importantly, how to stay safe while still effectively managing pain. 5 major dangers of ibuprofen over 50. Now, let's delve into 5 major dangers that might surprise you. Number 1. Increased risk of stomach ulcers. Ibuprofen belongs to a class of medications called nonsteroidal anti-inflammatory drugs, or NSAIDs, known for their ability to relieve pain, reduce inflammation, and lower fever. However, one of the common side effects of NSAIDs, including ibuprofen, is an increased risk of developing stomach ulcers. This occurs because NSAIDs inhibit the production, which are important for maintaining the protective lining of the stomach. As a result, the gastric mucosa becomes more susceptible to damage and erosion, leading to the formation of ulcers. Stomach ulcers often present with symptoms such as abdominal pain or discomfort, indigestion, heartburn, nausea, vomiting, and bloating. In some cases, they can cause more severe symptoms, such as black, tarry stools or blood in the stool, indicating gastrointestinal bleeding. To reduce the risk of stomach ulcers while using ibuprofen, it is advisable to follow some preventative measures. Firstly, it is recommended to take the lowest effective dose for the shortest duration necessary to manage your pain or inflammatory condition. Additionally, taking ibuprofen with food or milk can help protect the stomach lining. If you experience any concerning symptoms, it is essential to seek medical advice promptly. Number 2. Impact on kidney function. Ibuprofen can have adverse effects on the kidneys, particularly when used for an extended period or in high doses. It exerts its influence by constriction of the blood vessels leading to the kidneys, reducing blood flow and impairing the proper function of these vital organs. Additionally, it can inhibit the production of certain substances involved in maintaining healthy kidney function. Impaired kidney function may manifest as decreased urine output, swelling in the legs or ankles or edema, fatigue, shortness of breath, or changes in overall kidney function as indicated by abnormal blood test results. Monitoring for these symptoms is crucial, especially for individuals over 50 who may already be at higher risk for kidney-related complications. To minimize the impact on kidney function, it is important to stay well hydrated while taking ibuprofen. Adequate hydration helps maintain proper blood flow to the kidneys and supports their function. Following the recommended dosage and duration of ibuprofen use is also critical. Number 3. Increased cardiovascular risks. While ibuprofen is effective for reducing pain and inflammation, it is important to recognize that it can elevate the risk of cardiovascular events, such as heart attacks and strokes. This risk is more pronounced in individuals with pre-existing cardiovascular conditions or those who use ibuprofen for an extended duration. Symptoms of a potential cardiovascular event include chest pain or discomfort, shortness of breath, sudden weakness or numbness, speech difficulties, or other signs of a potential cardiovascular event. These symptoms should not be ignored and should be promptly reported to a healthcare professional. Individuals with a history of heart disease, high blood pressure, or other cardiovascular conditions should exercise caution when using ibuprofen. In some cases, alternative pain management options may be recommended to minimize cardiovascular risks. Now, before we proceed to the next surprising danger of ibuprofen, like and subscribe to NATURALdocTv to stay updated. Number 4. Potential interactions with other medications. Ibuprofen can interact with various medications, potentially leading to reduced effectiveness, increased side effects, or adverse reactions. For example, when combined with certain blood thinners, ibuprofen can increase the risk of bleeding. Similarly, some antidepressants, antihypertensive medications, and diuretics may interact with ibuprofen, affecting the therapeutic outcomes of both drugs. It is crucial to be aware of potential interactions with specific medications. For instance, nonsteroidal anti-inflammatory drugs like ibuprofen may interfere with the efficacy of selective serotonin reuptake inhibitors, or SSRIs, a type of antidepressant. This interaction can disrupt the balance of serotonin in the brain and affect treatment outcomes for depression or anxiety. Additionally, combining ibuprofen with certain antihypertensive medications can lead to elevated blood pressure levels and may hinder efforts to manage hypertension effectively. To mitigate the risk of drug interactions, it is important to disclose all medications, including over-the-counter and herbal supplements, to healthcare providers. They can assess potential interactions and provide suitable alternatives or adjust dosages accordingly to minimize the likelihood of adverse reactions. Keeping an updated list of medications and sharing it with all healthcare professionals involved in your care can help ensure comprehensive and safe treatment. Number 5. Effects on bone health. While ibuprofen is primarily used for pain relief, long-term and high-dose use of this medication can have negative implications for bone health. Ibuprofen interferes with normal bone remodeling, a process through which old bone tissue is replaced with new bone tissue, leading to decreased bone mineral density and increased chances of fractures. Studies have shown that chronic use of ibuprofen can contribute to decreased bone density, impaired bone healing, and an increased susceptibility to fractures. This risk is of particular concern for individuals over 50 who may already be at a higher risk of osteoporosis, a condition characterized by weakened bones. If you have concerns about bone health, adopting a calcium and vitamin D-rich diet, engaging in weight-bearing exercises, and avoiding tobacco and excessive alcohol consumption can contribute to better bone health. How and when to take ibuprofen. When it comes to ibuprofen, following the recommended dosage instructions is crucial. For adults over 50, it's best to stick to the dosage instructions on the packaging. Avoid exceeding the maximum daily dose and don't use ibuprofen for an extended period without supervision. Timing considerations. Taking ibuprofen with food or milk can help reduce the risk of stomach irritation. It's also important to space out doses appropriately and avoid taking ibuprofen too close to bedtime to prevent potential stomach issues. By timing your doses correctly, you can minimize the risk of gastrointestinal discomfort. Duration of use. Ibuprofen should only be used for short-term relief of pain or fever. Using it for an extended period can increase the risk of adverse effects. If you find yourself needing ibuprofen frequently, it's essential to explore alternative treatment options. Interaction with other medications. Before taking ibuprofen, it's essential to consider potential interactions with other medications you may be taking. Certain drugs can interact with ibuprofen and increase the risk of adverse effects. Always check for interactions and be cautious when combining medications. It is crucial to recognize the potential dangers associated with the use of ibuprofen, especially for individuals over 50. Understanding the risks and taking necessary precautions, such as following recommended dosages, discussing alternatives with healthcare professionals, and monitoring for any concerning symptoms, one can prioritize their well-being while effectively managing pain. In addition to the dangers highlighted above, it is essential to acknowledge that ibuprofen can also cause allergic reactions, gastrointestinal bleeding, and rare but severe skin reactions. As with any medication, it is important to carefully read and follow the instructions on the label. Your health and safety matter. So stay informed. Take proactive steps to minimize risks and make informed choices when it comes to pain management. If you enjoyed this video, please like and subscribe to NATURALdocTv for more health and wellness tips, including natural and homeopathic treatments. Also, feel free to share any questions or comments you may have, and we'll see you next time on NATURALdocTv. And before you go, watch our other interesting video to gain valuable insights that could change lives. Find out how methylene blue dye holds the keys to unlocking potential miracles in treating dementia and Alzheimer's disease.